meet you.
You too.
I'm Dr. Rossini. I specialize in orthopedics, and I will be taking care of you today. So you are 5'4", 140.
Yep.
And I hear you've been having knee and hip pain, knee and hip swelling, and limited joint movement.
Yes, that'd be correct.
Okay. So we're going to run some tests. But before we do that, I just want to go over some family history with you. I heard your grandfather fractured his hip.
Yep.
And your father and grandmother had osteoporosis.
Yes, that would be
So
correct.
that runs in the family. Okay. Do you exercise regularly?
No, I have not been.
Is there a reason for that?
It hurts.
Okay. Well, we want to get you to a place where you can exercise regularly.
Okay.
Because it is good for you. So we are going to run some tests. The ones that take a little longer, we're going to run some x-rays, we're going to do a CT scan and an MRI scan to see your bones and the soft tissue around them, to see if they're swelling on the inside, to see the cartilage, how much you have left. So let's go. Hello again. I have your results. So your temperature, 98.6, normal. Heart rate, 78 beats per minute, normal. Blood pressure, 120/80. It's actually really good.
Oh, thank you.
Blood test, nothing suspicious was found. But you're swelling in your knees and your hips, like you said. You said that your pain level was pretty intense. So in the x-rays, we saw small deposits of bone growing on the edges of your joints. So on the edges of your hips and on the edges of your knees. Small pieces of bone are breaking off and floating around in your synovial fluid. You do have some abnormal shaping of your bone because the cartilage is wearing down and your bones are rubbing together. So I wanted to show you your x-ray results. So these are your knees. As you can see, the cartilage is basically none. They're rubbing together. It's not good. Same with this one. It's a little rough. And you can see here that there are small pieces of bone floating in your synovial fluid. And this is what your knee will look like after when it's replaced. So hopefully that means no more pain at all. And same with the hips. There are pieces broken off, and we need to fix that. And that is what they look like when they're resurfaced.
All right.
Okay. From the CT scan, we actually got a clearer picture of the cartilage wearing down, and from our MRI scan, we saw that you basically have none.
Oh.
And that brings us to our course of action. So our course of action, eventually you're going to have to get both knees replaced and both hips resurfaced because they're rubbing together and that's really bad. So we plan on getting you in for your left knee replacement ASAP and the right one 6 months later, and then your left hip resurfaced a year later, and then the right one resurfaced 6 months after that.
And then no more pain?
Hopefully no more pain.
Woo!
So you should be coming in for your surgical consultation on April 8th.
All right.
And we do plan on getting your left knee replaced right away. And I should see you then.
All right.
All right.
Thank
It was
you,
nice
doctor.
meeting you.
Thank you.
Thank you.
Ready? Go!
It's on.
I know.
All right.
I'm waiting for her.
Edited unlike you.
Wait, okay.
Wait,
I'm
let
ready.
me adjust.
Okay.
All right. Carol, put that down. Put that down. That was pretty good.
That was good. That was good. That was nice.
Focus.
She just hit me with that thing.
I'm sorry.
That's mean.
Excuse me.
Don't make me go on it!
Okay.
Damn it, Kara! that would be correct.
Okay, ready? Your
Are you old enough to be a doctor, young lady? It hurts.
okay.
It hurts my bones. I'm a doctor. You're pretty. It hurts my bones. I'm ready.
Those small pieces of bone were also breaking off and floating around in your synovial fluid.
That's not good.
Thanks, Captain Obvious.